Well, I was like 9 years old. I was a kid, and it was really horrible. 2 in the morning, I was sleeping, but then I felt like I was getting wet. So when I opened my eyes, the roof of my house was already gone. Everything was absolutely destroyed. The houses, there were pieces. The trees all around Bluefield was green. But after Hurricane Joan, it changed completely everything in Bluefields.
Joan hurricane affect Bluefields a lot. Really, we still don't recover that yet. You still have old people talking about their losses and talking about all the disaster that happened in those times. And I know it shocked us big because we wasn't prepared for it. We should start create awareness and be prepared for this kind of disaster because come on, we are exposed to them.
What they have told us for Pearl Lagoon, that in 75 more years, there wouldn't be such thing as Pearl Lagoon. Pearl Lagoon, according to the estimate, in 75 years should be underwater. That's how fast it is going.
Nurses are critical to helping communities be prepared for disaster subsequent to climate change. Climate change being a somewhat slow but hugely impactful process allows us, I think, to really maximize the nursing skill set. We work at the individual, the family, the community, and the systems level. And as a public health nurse, prevention is our #1 charge. So I think that we can do everything along the continuum for disaster preparedness, from at the one extreme triage and building capacity with nurses to be able to respond to an acute disaster, but on the other end of the continuum, working with communities to make sure, for example, their family has a disaster plan, their community has a disaster plan, that there's clear communication in the case of a disaster, that certain preparations have taken place critical to a community's resilience subsequent to a disaster. I started my nursing research career looking at women's health and health disparities, and I didn't necessarily think of myself as a climate change researcher, but have found that through the approach of figuring out with community partners and long-term folks that I've collaborated with in Nicaragua, that's such a pressing issue, and it's so intertwined in women's health and development in this area that it's become my area of focus. Here in Nicaragua, where Bluefields is, there's only one school of nursing. And so that public school of nursing attracts students from all over the communities in the Southern Autonomous Region. As such, when students come and study and then return home to their communities, they're seen as leaders. So people go to them for resources, people go to them for questions and answers, but we, through this project, have really worked to try to have them be those proactive leaders that assess people's housing, that assess how disaster plans might work in their individual communities. In Nicaragua and in many communities in the Caribbean, or communities where economies are so dependent on environmental conditions and factors, the margin of impact is really razor thin. And so we see more directly the impact of climate change in communities like Bluefields, where the economy is so dependent on those environmental factors. So
Climate changes, you won't believe that climate changes could carry you to drug trafficking. It's something that it's a line that keeps there, and when you have a problem, you go to another and another, and it increases.
So the project started with a request from the School of Nursing leadership, because in the event of a disaster, it's very likely that a foreign aid response would be part of mitigating that disaster. And as such, we thought it would be a good beginning place for the partnership to have our students who don't necessarily speak Spanish partner with students here from BICU to learn about what that process would look like. We subsequently have shifted more towards making the capacity building efforts be more sort of bi-directional, I guess. So we focus on the potential disasters or potential impacts of climate change here in Bluefields, have our students and faculty here inform what the cases are that we develop, and then our simulation process is what takes the conversation from that acute response, that triage. The conversation and the simulation process brings us then to, okay, what can we do to prevent this in the future? The School of Nursing here has really integrated this into their curriculum in several different ways. They've changed their course objectives to include disaster preparedness, which is really phenomenal. They also now require students to create one of their own scenarios for simulation, and with their colleagues and fellow students enact them. So that now is part of their curriculum, that they're required to develop a scenario and show how they would respond to it.
Bueno, como experiencia fue algo interesante, ya que anteriormente ya lo hemos practicado muchas veces, lo hemos visto ya en los puestos, ya de forma real, pero igual aquí se hizo una simulación, considero no salió tan bien, pero sí se puede observar que tenemos un poco de conocimiento, lo cual es importante a la hora de brindar la ayuda a los demás.
So simulation really has been a tool to help shine a lens on some of the ideas and the strategies that are already being used, but highlight them in a way that then all the rest of the students can benefit. And not just students here at PICU, but our students at UVA too.
As a student, it's just like, oh, this isn't real, or you know, it's like in real life it would be different. But I feel like for the disaster simulation, it was really sort of more true to form, because you are, like, let's say there's an earthquake or a hurricane, you might not get supplies, or you know, there are barriers and you can't get a delivery of something. So it really stirred up the conversation of, in real life, things like this do happen, but here's what you can, how you can manage it.
With the help of the Jefferson Trust, we've been able to directly bring people who have been integral to our development of the project here in Bluefield to Charlottesville, and they've interacted with our students, given them their perspective as well, which has been a really great benefit.
Entonces, con este hermanamiento que hemos tenido durante tantos años, ya nosotros como que vamos viendo la utilidad y nos va ¿cómo decir? Fortaleciendo a nosotros como escuela para nuestros recursos.
They learn from us, but also we learn from them, and so it's an exchange. It's circle. It's a circle, and everybody wins.
Our students are increasingly in acute care clinicals that are extremely high resource, highly specialized. And so to put yourself in a position through the simulation where there's low stakes but high yield in terms of what you learn is a really powerful thing.
I thought it was fun. In real life, you don't have everything. You might not have everything, especially in a disaster, or there are limited resources. So learning that communication and trying to be as creative as possible, working with what you got.
That awareness, that cognizance of the experience of others and the experience of most of the rest of the world seeing these acute impacts from climate change is critically important for our students and as global citizens.
Working with UVA, it's like finding a light so it could guide us into bettering our way of living.